Hello everyone! This is a video regarding one of the global health disparities topics, which is the focus of the HBB March Research Program. Now, we have attached a list of potential topics in your first assignment, but that list primarily serves as inspiration to deciding your final research topic. We would love for you to choose something that you're passionate and interested in and adapt it to your own context. And we will only be creating videos on around 3 of these topics, and you will be required to watch at least one of them and write a few sentences about it as part of your first assignment. And the point of this is to help you learn about some of these issues, and it may even lead you to a potential research topic. So this presentation is going to be about how education levels affect healthcare decisions in individuals and communities. This presentation was created by one of our wonderful volunteers as part of the HBB Resource Creation Volunteer Team, and they spent a lot of time and dedication into creating these amazing presentations, so we just want to take a moment to appreciate their hard work. Now, what is health literacy? So it's essentially the ability to obtain, understand, and use health-related information to make well-informed and confident decisions about their health. Now, it really does have a direct impact on people's health outcomes and their general well-being, which means it's really an essential part of healthcare in general. And a person who has a high level of health literacy is more likely to just better successfully navigate the healthcare system in our current world. However, there are significant differences in health literacy across various communities and countries, and these are driven by so many different factors, some of which including socioeconomic levels, cultural backgrounds, and the amount of education that an individual or a community receives. So, what's the importance of this education in healthcare decisions? So, the development of health literacy is significantly influenced by the education that one received. And higher educated people are more likely to have the knowledge and abilities necessary to understand complicated medical information and to just understand their prescription requirements and base their judgments on advice from medical professionals and healthcare professionals. So higher educated people, for example, are better able to understand medical jargon and vocabulary, just understand basic test results, and understand what their health insurance options means. So all of this is going to lead to more efficient healthcare management as a whole. But on the other hand, people with less knowledge are going to find it more difficult to understand basic health information, which could also lead to misunderstandings with healthcare professionals, improper prescription use, or even a failure to take action based on some of these issues that result from health complications. And this could lead to very intense situations such as unnecessary hospital stays, increased healthcare expenses, and poorer health outcomes. So this is all caused by this health literacy gap that we see in less educated people and more educated people. So in order to close this gap, what we really need is culturally appropriate health resources. People from different cultural backgrounds frequently see health, illness, and treatment in different ways and contexts, and health organizations and providers should be aware of these cultural variations, and they should be modifying their instructional materials and resources appropriately. And this really utilizes language and scenarios that appeal to different target audiences, and basically taking into account the different cultural values and beliefs that these groups have to provide resources in an approachable and easily comprehensible way. For instance, language challenges, literacy levels, and the cultural relevance of some of these particularly some of these particular health habits should all be taken into account when creating health information for immigrant groups, for example. And health education that's culturally sensitive and culturally appropriate can actually increase patient comprehension and promote medical recommendations and build this just patient-provider trust within the community. So by giving all of these different populations and groups the different resources that they need to make these educated health decisions, it can also lead to the reduction of these health disparities that we currently see. Now, let's talk about how misinformation spreads in different cultural contexts. So there's so many factors that can lead to misinformation, such as social media, word of mouth, and just disinformation networks. These can all lead to the rapid cross-cultural transmission of false information, especially when it comes to health. So misinformation can have strong roots in these traditional beliefs and these traditional beliefs of different cultural groups. So, for instance, people are going to start turning to family members or informal sources, including social media or trusted community members, for health advice when they lack their own means to evaluate their health information critically. Now, this is going to result in the spread of false beliefs or improper behaviors when it comes to health, and essentially widening the health disparity gap. So, language hurdles, skepticism of these established medical systems, or even limited access to trustworthy healthcare resources can all lead to the spread of misinformation in some of these different cultural contexts. For instance, people may be more receptive to rumors regarding vaccinations, medical procedures, or the advantages of particular health behaviors in communities with less health literacy. And misinformation about health can also be culturally specific, with local customs and practices that influencing views about certain diseases or treatments that can not even be consistent with scientifically supported medical knowledge. So it's really important and crucial that we are creating these culturally relevant materials to ensure that this is not occurring. And once again, rapid disseminating false information can also have detrimental effects, particularly during public health emergencies such as the COVID-19 epidemic. And lack of this trustworthy access to healthcare and health education is going to put a lot more communities at greater risk of being misinformed, which can essentially sabotage public health initiatives, incite fear, and lead to vaccine reluctance or refusal of effective treatments for these issues. So here are the links to some of the sources, and thank you for watching this video. Once again, we really appreciate your time for watching this video. If this is the one that you chose to watch, please complete a few questions in your first assignment. You're going to have to answer a few questions about this, and it's going to be kind of a personal commentary about this presentation. So thank you for watching.